Prostate cancer is the second deadliest cancer for men. Most men feel nothing until it's too late. 1 in 8 men will get it. If you're over 50, your risk just skyrocketed. But here's the crazy part. When caught early, the 5-year survival rate is nearly 100%. Caught late, it drops to 30%. This tiny, walnut-sized gland sits right below your bladder. Its job? To make the fluid and semen. As you age, it grows. That's totally normal. But sometimes, cells inside go rogue. That's prostate cancer. Most men have 0 symptoms early on. But watch for these red flags. Peeing way too often, especially at night. A weak or interrupted stream. Blood in your urine or semen. New erectile dysfunction. Or pain in your hips, back, or pelvis that won't go away. If you're over 45 and have even one of these, book a doctor's appointment tomorrow. The #1 way to catch it early? A simple blood test called PSA. Higher than normal could be a red flag. But here's the catch. PSA can be high because of an infection, sex the night before, or just an enlarged prostate. So doctors often pair it with a rectal exam and sometimes an MRI to get a clearer picture. Let's make the stages simple. In stage 1 and 2, the cancer is still inside the prostate, making it almost always curable. At stage 3, it's starting to break out, but it's still very treatable. In stage 4, it has spread to bones or other organs. At this point, we fight hard, and many men can live for 5 to 10 years or even longer with new drugs. Now for the good news. Treatments today are nothing like they were 20 years ago. Here are your main options. First, active surveillance. If you have low-risk cancer, doctors might just watch it closely with no immediate treatment needed. Second, surgery. Robotic prostate removal is common, and most men maintain continence and potency. Third is radiation, which uses super precise beams or tiny radioactive seeds planted inside the prostate. Fourth is hormone therapy, which starves the cancer of testosterone. Fifth, we have new generation drugs like PARP inhibitors, PSMA-targeted radiation, and immunotherapy. And finally, chemotherapy, which is typically used only when the cancer is aggressive and spreading. Men diagnosed today live longer and better than ever before. Now, let's have some real talk about side effects. We're not going to sugarcoat it. Treatments can cause leaking urine, trouble getting or keeping an erection, and hot flashes or fatigue. But there are solutions. Pelvic floor therapy, pills, injections, and even penile rehab programs can help. Most men do get their quality of life back. So, what is the one thing every man must do? If you're between 45 and 50, or if you have a family history of prostate cancer, start talking to your doctor about the PSA test. For Black men and those with a strong family history, it's recommended to start these conversations at age 40. One 5-minute conversation and a simple blood test can truly save your life. You're not just a statistic. You're a dad, a husband, a brother, a friend. Early detection isn't scary, waiting is. Drop a blue heart in the comments if you're getting checked this year. And please, tag the men you love in this video. This information could save their life. For a full guide and a free symptom checklist, check the link in the description. Thanks for watching.